On to something that has great interest to me,
yes.
although 30 years too late. With us is Dr. Tirso del Junco, Jr. Dr. Tirso del Junco, Jr. is talking to us this morning, and we hope he'll come back when we have more time, about a surgery that I had when I was 23, a complete hysterectomy for a disease called endometriosis. The disease still exists, but the surgery now is not necessary for that and for a lot of other what we used to call female problems.
Right.
This is fascinating, and it's a matter of controversy and great discussion now.
It is.
Welcome to you.
Thank you. Thank you for having me.
Are you saying I am in my early 50s now? Even when I was 23, I could have avoided that entire hysterectomy because of an endometriosis problem?
What we're saying, Stephanie, is that primarily the diseases that are causing women to have so many hysterectomies, 650,000 a year. If you take that number of 650,000, probably only 12 to 15% of it is done for cancer. There's a significant number of hysterectomies that are being done, primarily the number one reason being fibroid tumor disease. Endometriosis being an associated disease that we see quite frequently with fibroid tumors.
Now, you're addressing the comment by many doctors who say, my dear, you've had your children. We might as well get rid of that problematic part of your body.
Right.
What do you say to this?
Well, there's a lot of studies that are showing that that the uterus does function other than just carrying and bearing children.
Yeah.
And to be able to retain your uterus from a perspective of preventing heart disease, osteoporosis, and a topic that was taboo and is very much taboo until recently is sexual dysfunctions that go along with having a hysterectomy. So what we're saying is, in your case at age 23, the associated disease of endometriosis doesn't, by and large, mean that that is the only form of treatment. And what I'm arguing about and what I tell women is that we're going to give you a choice, because in theory, removing fibroid tumors has been a procedure that's being done in this country for 30, 40 years. The medical necessity or the physician to determine whether or not he can do it technically was, number one, because he loses too much blood, B, because of the reasons that you've stated, a philosophical approach being the three major reasons. I'm saying that we don't need to deal with either one of those issues because the procedure that I'm doing safely can be done without losing much blood. I've removed up to 65 tumors out of a woman's uterus and reconstructed her uterus, and she never lost blood.
And this is with the marvel of laser.
Right.
Laser is, it's a miracle.
In the procedures that I do, we use 2 and 3 different types of lasers depending on the type of disease process we're treating. But female alternative surgery doesn't just deal with the uterus. It deals with the ovaries, the fallopian tubes. Sometimes there's a prolapse of the uterus as a result of the fibroid tumors. And in your case, it wasn't so much a uterine disease as much as it was an ovarian and fallopian tube disease.
Where do you practice?
Here in Glendale.
People will want to know.
No. Doctor, they are running us along. You will come back to talk more about this, a topic that is of interest to so many. For more information on the Institute for Female Alternative Medicine at Temple Community Hospital, you can call them. It's 800-505-4326. 800-505-4326. We come right back. The results of our audience poll. Is ER worth the money? We'll find out as the live show continues.
We'll be right back. Thank you, Doctor.